My name is Gabor Racz. I'm from Dallas, Texas. This time I came over to our annual Interventional Pain Conference, the 22nd one, and it so happens it coincides with the pain school that is running parallel, but with everybody's involvement and blessing on an adjunct faculty basis. They are preparing people to learn, and they can ask as many questions. They watch patients being done, procedures. They have a chance to work on cadavers, and it's a win-win situation. WIP is a not-for-profit establishment. We started the Budapest conference really many years ago, but this year is our 22nd annual conference, and the two just relate very well together, and I believe it's going to be a success all the way around, because I love when people want to learn. I spent all my life as a professor in academics and trained many, many people. And I believe the fate for the pain school, with a bit of luck, you always need luck, is going to be very, very similar to what we have achieved with WIP. And there are many ways of learning, and this is one very delightful way, but you know, it's taxing. I hope they have the stamina, and the stamina really comes from having a base where the work goes on regardless whether you have students or not. And then people are so excited about teaching that they come with tremendous experience. So everybody learns, everybody benefits from the interaction. Our field is growing, our field is getting better, and our patients benefit from it. The doctors have to make up their own mind up because it's a lot of work. They have to read and give up their time, and amazingly, once you get this feeling, I want to do some, all, or part interventional pain, you better learn how to do it. You know, like I have passed on a lot of knowledge, not only to the 160 some fellows we trained, each one a year, but I had over 1,000 doctors from all over the world to come for a week or two or up to 6 months. And they learned, but you know, we had a busy clinic. They would see many procedures, then we give them reading material. They would take notes and write it down every night in the hotel room. And that's a form of learning. Here, what I watched doing radio frequency sphenopalatine ganglion or Gasserian ganglion procedure. How do you position the patient? If you have any questions whatsoever, you have the answer right away. If you don't have this chance, it takes you years to figure out how to do something that makes you better and safer, and it's better for the patient.